Okay, this is the time of year to get stuck in shopping traffic, then hurry and scurry as you go about getting your shopping done. We're walking a lot of extra steps this time of year. Dr. James Gooden is here with Milligan Vein, and he says it might be that you'll notice some pain in your legs and you don't want to ignore it. Good to see you.
Good to see you too.
So I hadn't thought about that exactly, but you've told me before that so many people have vein disease and they don't even know it.
Right. A lot of people just chalk it up to getting older, or just kind of the just the kind of daily sort of discomfort that we just kind of try to shove out of our mind and put our head forward and just work through.
But the pain you're talking about can reach a point anyway where it really is a little bit debilitating, and so this holiday shopping we're talking about can be almost impossible for you.
Yeah, we see a lot of patients that come in this time of year and they've noticed just the increased activity that comes with the season, the shopping, the cooking, the spending time with family and that sort of thing. And they've noticed that they can't quite do as much as they would like to, or as much as they used to. And a lot of times we see these folks and we go through the process of evaluating them and find out that they do have vein disease, and it's treatable and reversible.
Is the pain the same for everybody? Is it going to be like a dull ache? Is it a shooting pain? What does it feel like?
We see sort of a collage of different types of presentations, but yes, it's usually a dull, achy, or just tired from the minute you get up in the morning kind of feeling in your legs, heaviness, and then it can be itching and burning and just sort of the whole thing.
Does it tend to happen on one leg versus the other, or will you have it happen in both?
It can be both. So aside from genetics being the main sort of risk factor for getting vein disease, injuries and having had surgery on a leg, that can contribute to it as well. There's some sort of less common conditions that can lead to having vein disease on one leg and having a very relatively normal looking leg on the other.
Right.
But we don't see that too often.
You have stressed before how easy it is once you've diagnosed it for you to treat it. I mean, and it's usually done in a day in office, right?
Well, the average person that comes to see me that is having symptoms in both of their legs, and then we go through the process and they end up needing some surgical intervention, I will do somewhere between 2 to 4 procedures on that patient in order to get their legs as healthy as I can get. And that's true about 88% of the time. So 1 out of 10 patients will need me to go a little bit further with other types of treatment.
But when that's happening and they're coming back to you, they're not having to be in the hospital, right?
Everything that we do is we take care of you comprehensively under one roof. Right. So you come and see me at the office, you get your ultrasounds at our office, and we do our surgeries at the office too. So,
okay, let's take a typical patient, if there is such a thing as a typical patient, because I would imagine it's somebody maybe a little bit older, maybe 60s or 70s, dealing with something. I think you see young women too.
I see folks in their 20s all the way up to their 90s. But yes, the majority of folks that I see are, 50s, 60s.
Okay, so maybe they've just begun to notice that tired feeling. Are they necessarily seeing anything, or are they feeling it?
Sometimes it's the visual thing that actually kind of pushes them over the, is sort of the final straw that brings them to my office. Yes, yeah. And they may see the spider veins arising, or that they've got visible varicose veins under pressure, and they make that correlation, and that's what brings them to my office.
Okay, so in they come. Let's pretend that they've seen a spider vein, and they come to you, and you are going to just do an ultrasound first?
Well, we'll do an evaluation and kind of try and tease out what kind of symptoms you're having, other than just, if it's just purely there's a spider vein and it's unsightly, we have a treatment for that, and it's fairly simple. It involves just injecting medicine into those veins and they fade away. If you're having symptoms, then that sort of warrants a more in-depth workup, including an ultrasound. And once we have sort of diagnosed you with vein disease, and it looks like surgery may be the solution to get you the results that you want, we start a non-operative therapy trial that is sort of mandated by insurance companies before we can get to the surgery.
You just had a very important phrase, and that was insurance companies. So this is something that most insurance companies will cover?
99% of what I do is covered by insurance.
Okay, that's very important for people, because if you don't get this addressed, forget the vanity side of it, this will really impact your overall health.
It will, and not only it can affect your health directly in that Chronic inflammation from vein disease over time will sort of injure the skin, not just the color or the appearance, but also the architecture of the skin, and make it prone to getting wounds, or when you do get wounds, make it very difficult to heal those wounds. And then secondarily, it affects you in that you're not as active. And so being active is an important part of being healthy.
I have like a minute and a half left. Does diet play a part?
Well, we do see, again, I'll stick to my guns in that genetics is the #1 risk factor for getting vein disease, but being overweight can certainly exacerbate it as well.
Okay, so watch that over the holiday season. I think smoking is something to avoid if you can.
Regardless of what medical topic we're talking about, smoking should be avoided, absolutely.
But to know that he's going to come in, evaluate you right there in the office, and whatever your treatment protocol calls for, they'll do it under their roof as minimally time requiring for you as possible. It's a great thing.
And we try to make it convenient for folks.
Yes, you do. Thank you, James.
Thanks for having me again.
You can find him at Milligan Vein in Cleveland, 961-5682, online milliganvein.com.